According to the Office for National Statistics, August 2022 saw the highest mortality rate in England for 15 years. That's a graph from Jamie Jenkins, former head of health statistics at the ONS. That's at his Twitter feed and his website. And Jamie joins me. This is a real thing, and we ought by now to know why it is, shouldn't we?
Well, we should do, Mark. What we had a few months back was the Department of Health were kind of questioning the figures themselves because they were being asked by kind of, I think, journalists from GB News about what's going on here, and they've called for an investigation. And if we start looking at the figures, Mark, since about the middle of May, we've been seeing higher than expected deaths of what you would expect for the time of year. So overall, it's about 25,000 more deaths. And if you take the average numbers from the period 2015 to 2019, now, part of that, Mark, is explained by the population structure. So I've been looking at the figures, calculating some numbers myself, and we've got more older people than we had back in 2015 to 19. Part of that is to do with the baby boomers from the Second World War. So if you account for all of that, Mark, we're seeing still 10,316 more deaths at the moment now than what you'd expect since around the middle of May. Now, the August figures are quite revealing, as you just talked about, which I put on my Twitter feed, and the ONS published last week, which is that we've seen the highest death rate in August since back in the mid 2000s. 2010 to 2020, they stagnated a bit, but the 2022 figure is higher than 2020 and 2021, even though we were kind of in the midst of the pandemic. Now, if you take out deaths linked to COVID, Mark, because we have had a mini wave of COVID through the summer months, what's kind of alarming, I suppose, is that we're seeing fewer deaths among older people over the age of, say, 70, which is not surprising because lots of those have been dying kind of from COVID through the pandemic and through the summer. But we are getting more deaths in those younger age groups, which are the ages 20 to kind of 59. And then you can look at data on causes from the Office for Health Disparities, and heart issues are coming up. And we talk about higher than expected deaths here, Mark. The concern for me is that this is happening every single week. You know, you talked about it in the past. I'm on again talking about it about a month later. I don't think we should be calling it higher than expected. This is looking like the new normal now, which is quite concerning.
Well, if the new normal is myocarditis for teenagers, then we've done something very badly wrong. You're not a conspiratorial person, and you've suggested the least conspiratorial explanation is that the NHS has just seized up, and basically in about May it packed up and no longer works. But, you know, other countries with functioning healthcare systems, both on the continent and in the United States, have similar figures. So it seems, you know, and they can't blame it on the NHS. So do you think we need some kind of pan-developed world explanation for all this?
Well, no, I do indeed think that, Mark, because part of the issue, as I said, we've got 25,000 more deaths than what you would expect when you look at the 2015 to 2019 numbers. But part of the excesses we are seeing across most of the Western world, for example, are because the population structure, we had a lot of kind of births after the Second World War. They're reaching that age of 75 plus, where they would naturally kind of reach the age of dying. So that does explain a lot of what we are seeing across the world in terms of the excesses, but not all of it. Now, the NHS, Mark, which you just touched upon, it kind of has collapsed. We have seen long waits in A&E, and when we see long waits in A&E, we know people don't get seen quick enough. That leads to more deaths. We're seeing ambulances stuck outside of hospitals. That leads to more deaths. We got record numbers of patients in hospitals, in beds, not being discharged. That leads to more deaths. But it then brings you back to what's the cause of all of this. The interesting thing, Mark, is we're not actually seeing more patients going to A&E across England. So we're not seeing more and more people who are seriously ill than what we saw pre-pandemic. So that's an interesting fact.
Yeah, that suggests that people have just given up on the health system. But these are two great, whether it's, you know, as I'm inclined to think it's something to do with vaccines, or you're inclined to think it's something to do with the total collapse of a health service, which has just been given the George Cross, they're both stories that the media should be covering.